been around for thousands of years, literally, compared to Western medicine. During medical school or standard Western medical training, we really received no information whatsoever in regards to acupuncture. I mean, quite frankly, I went through a residency and a fellowship and still knew very little about acupuncture. So that's neither here nor there. My experience was really gained out in the field. And obviously because of using it, I've developed a newfound appreciation for acupuncture. But I think it's very important when approaching an MD as an acupuncturist to somewhat speak in their terms, or in terms that they can understand and relate to and potentially be encouraged by. Now, what I mean by that is, it seems as though acupuncture is a therapy with its own, terminology, if you will, that's very different from Western medicine. Now, I personally have been very impressed when I have an acupuncturist approach me, or in doing my own research, with actual scientific data or studies which do exist that do show acupuncture is indeed helpful as compared to sham or placebo. Now that, I think, is a very convincing way to get the message across to a physician, above and beyond maybe adjusting terminology, because truly acupuncture and Western medicine philosophy are two extremely different types of approaches to pain management, and it's hard to kind of transform or translate one into the other. However, if you can prove your point with the effectiveness of acupuncture through actual scientific data and studies, which, like I said, do exist, I think that does a much better job of conveying your message. What's interesting about acupuncture is the majority of my patient population believes acupuncture is, almost a torturous process, or sort of a sacrificial process with large needles and electrotherapy or what have you. But what I like to explain to my patients is, number one, the needles used are very, very small, and they are definitely part of the therapy, obviously, so they are in effect not necessarily causing or creating pain, but potentially releasing it and working beyond it. Another thing that I've noticed with my patient base is they tend to tell me that the first 1 to 2 to 3 therapies actually exacerbate their pain, followed by a improvement after that point. So lots of my patients will go to acupuncture for 1 or 2 visits, and they'll come back to me saying, it's actually made things worse. Upon further encouragement for them to continue their therapy, they do come back stating, the first couple of therapies are indeed painful, but after that they do receive significant benefit. So I think it's important for an MD to have a baseline understanding of acupuncture, in the sense where they can tell their patients, number one, the needles used are extremely small and it's not necessarily a painful process, not compared to the things that we do here injection-wise. And there's really, there's anxiety associated with that, but that can be somewhat alleviated by the physician. And number two is, the first few therapies may indeed exacerbate the pain, but after that things tend to subside if acupuncture proves to be helpful for that patient. Physician standpoint is, it's becoming more and more accepted as a potential therapy to include alongside standard Western medicine techniques. I think historically, up until this point, from a pain management physician's perspective, acupuncture is something that's been reserved as maybe a third or fourth line, or kind of a last resort therapy. And quite frankly, I think that's inappropriate, because personally speaking, anecdotally, with my patient base, I've seen significant improvement with these patients when they utilize acupuncture alongside standard Western medicine techniques early on in the process. I've had the opportunity to have a handful of patients who have reluctantly pursued acupuncture secondary to my recommendation. And interestingly, a good number of those patients have come back stating that they have received significant benefit from the acupuncture that they were completely surprised about. And these are patients that have very run-of-the-mill standard chronic pain states, or maybe acute injuries that usually respond well to many of our first-line therapies. Now, for one reason or another, maybe these patients did not respond well to those therapies, and they have indeed responded to acupuncture. My name is Dr. Akash Bajaj. I'm a board-certified anesthesiologist, did my training in anesthesia at UCLA, followed by a pain fellowship at UC San Francisco, currently practicing in San Diego.